Hello guys, in this video we are going to see the disease of the external ear. We know that the external ear is divided into three parts. The first is the auricle or the pinna, or the auricle or the pinna, then the external acoustic canal, and the tympanic membrane. First we are going to see the auricle or pinna. Before we going to see the diseases and deformities, first you need to see the normal appearance of the pinna. The pinna has a primary is the it's a thing made up of single yellow cartilage, except the lobe which doesn't have cartilage. Then there's a helix opposite to it, helix anti-helix opposite to that. Then the ear has a tragus, opposite is a anti-tragus. Then there is a large portion divided by a crux helix into symba concha and kim concha. Okay, so this is the normal pinna. Then first we are going to see the disorders, congenital disorders. First anostia, that is absence of the pinna or auricle. Then it's microtia, or it's also known as peanut ear, where the pinna is very small or not characteristic size. Then macrosia, it is a very single ear is very larger than the other ear. This everything is comes under congenital disorders, guys. Then there is bat ear, where the helix edge is very sharper. You can see in this position. This is corrected. You can operate this is corrected ear. Okay guys. Then there is cup ear or lobe ear. In this the upper cartilage of the helix forms like a cup, so it's up like a cup like deformity. Okay, is considered ear severity. Then there is a cryptotia, where the upper cartilage fuses with the skin and appears as a fused part. Then there is coloboma, where there is a fold appears between the transverse part. Okay guys. Then other minority deformities include absence of tragus. The function of tragus is to collect the sound waves into the canal. In this case, the absence of tragus. Then there is Darwin's tubercle. You can see the tubercle in bones. So then the helix, there will be a Darwin's tubercle. It's not much of a deformity. Then there is stalls here, an additional fold developed between crux and anti-helix, helix and anti-helix stalls here. Then the lobule deformities include absence of a lobule, large lobule, bifid lobule. You can see bifid lobule. Then the attached lobule to the skin. Then preauricular appendages include a small part growing before the auricle. This is preauricular appendages. And then the preauricular pit or sinus opening, where some discharges came or infection spread through this pit or sinus. Then deformities will that are trauma due to trauma to the auricle, like hematoma of the auricle, where during any trauma there will be collection of blood between the cartilage and the perichondrium, resulting in the blood accumulation, and which will leads to a condition like this. This is known as cauliflower's flower. The boxers who experience this commonly due to repeated punches and the collection of blood. There may be laceration of due to trauma. There may be avulsion, on the part of the ear is pinna is disturbed or torn. Then there is frostbite due to the very cold conditions. The subcutaneous tissue become very necrotized. There are multiple stages like edema, necrotizing, like in frostbite. Then there may be keloid of the auricle, earning injury or any injury causes keloid in some people. This is the keloid. Okay. This is due to the over action of the granulation tissue or something else. Tissue repair injury, guys. Then inflammatory disorders. Inflammation pericarditis pinna, it is the inflammation of the cartilage. There may be relapsing, again and again it's occurring, relapsing pericarditis. There may be chondrodermatitis nodoralis chronica helica. In the helix there will be painful nodules. Okay guys, this is due to inflammation condition. Then there may be tumors of the pinna like cyst, dermatitis, keloid, hemangioma, papilloma, horn, neurofibroma. Next, then going to next section, that is the disease of the external acoustic canal. That can be congenital disorders like atresia, that is absence of the canal. Then coloral fistula, this is a brachial defect. Then there will be trauma or inflammation or tumors or other miscellaneous conditions. See in this condition ear atresia in some children, that may be one ear will be completely normal, other ear will be a unilateral atresia and anosmia, both are present. In this condition the external appearance is first important, because the another ear is still present, and the child can't hear through that. So in that condition first we need to do the pinaplasty, then we need to consider canaloplasty, where in cases of bilateral atresia plus anosmia, this bone anchored hearing aid should be first attached to a child, then there will be conditions like other pinoplasty, and pinoplasty and other conditions can be done. So to do this BOHA or bone anchored hearing aid, minimum 5 years is required. Before that we can place soft band hearing aid like that of children placing a band on their head. Then there may be coloral fistula, which is a first arch defect. um, First arch is defect. There will be both two openings, one present in the internal opening, another in the external opening. You can see the external opening begin audible here, and internal opening is inside the acoustic EAC, collateral fistula, special type of condition. There may be other condition like brachial sinus, brachial fistula, which also contains two openings. Okay guys, then maybe trauma to the EAC can occur. Then inflammations can occur, which can be in both infective or non-infective or reactive. In infective group, there is bacterial, this is localized auditory external, and is a diffuse auditory external. The localized recrutation is due to pharyngococcis. It is caused by staph aureus infection. Staph aureus infection infects a hair follicle. The glands got affected and it is localized to area. Whereas in diffuse external, everything till whole acoustic canal is infected. Most common cause is pseudomonas. And then there may be otomycosis infection or fungal infection. Different fungi affect the EAC, as like Aspergillus niger infect causes black color colonies. If it is infected by Aspergillus fumigatus, it produces green colored colonies. If it's get infected by the Candida, it produces white colored colonies like Cindy is there. Then there is a viral infection, herpes zoster oticus, where you can see vesicle formation in everywhere, in pinna, in outside the pre-auricular region, in tympanic membrane, in external meatus, everywhere guys. Then when we come to the reactive group, there may be eczematous otitis externa. It is the eczematous condition. You see severe stages are there. Okay, due to the discharge it produces eczematous. This infection due to the discharge from the ear. Discharge usually came from the middle ear infection, perforations area. Okay. Then there may be we measure a bacterial infection. It is malignant necrotizing otitis externa. The necrotizing is due to the infection, and malignant is a misnomer, because this infection is spread to the skull bases, and invasive infection of the arterial and skull base. Okay guys. Then there may be a primary colistium of the external auditory canal. The colistium is usually present in the middle ear, but there may be a bending growth of moss in the external auditory canal. So thank you for the video guys.